Good afternoon, everyone, and welcome to the Government of Anguilla's third virtual press briefing as it relates to the current outbreak of COVID-19 in Anguilla. I'd just like to start with a prayer. Heavenly Father, we ask for strength and you gave us difficulties to make us strong. We ask for wisdom and you gave us problems to solve. We asked for prosperity and you gave us purpose and brains to use. We asked for courage and you gave us fears to overcome. We asked for patience and you gave us situations where we are forced to wait. We asked for love and you gave us troubled people to help. We asked for justice and you called us to be just and lead with integrity. Lord, we have received nothing that we have not asked nor wanted, and yet we received everything that we needed. And for this, we give thanks. Amen. So the agenda for this afternoon's press conference, we will start with the opening statement by the Honorable Premier and move to an update from the Chief Medical Officer and the Permanent Secretary in Health. We will then move on to an update in education and followed by a question and answer segment.
Good afternoon, fellow Anguillians and residents of Anguilla. I greet you as Premier and Minister of Health. And today I'd like to start with a press statement from the Ministry of Health. We do know that we are at this time in a public health emergency where we have a cluster of COVID-19 infections in Anguilla. The testing, contact tracing, isolation, quarantine is ongoing. I start with the press statement. This evening at 23:59 hours or at 11:59 p.m., the following regulations will be in place to combat the spread of the COVID-19 virus in Anguilla. Restrictions on movement of persons. Every person shall remain confined to their place of residence, inclusive of their outdoor space, between 23:59 hours tonight and 23:59 hours on May the 6th, 2021, unless you work at or accessing services that approve essential services. The full regulations with the list of essential services and their operating hours will be soon gazetted and available on the Beat COVID-19 website and other government websites and social media pages. All other services and businesses not approved in the regulations are not to open to the public. The operating hours to the public for these essential services, other than those for emergency care, police services, and other utility services that run 24 hours, is 6 a.m. to 4 p.m. Additionally, all persons who are not employees of 24-hour essential services or who are not accessing emergency health or police services are not to be in public, but remain in their place of residence between the hours of 6 p.m. and 6 a.m. daily until May 6, 2021. Additionally, where shopping is necessary, no more than one person per household is permitted to shop at any one point in time at any of the establishments approved under the regulations. Physical distancing requirements. Every establishment permitted to operate under the regulations shall A, endeavor to facilitate physical distancing of no less than 3 feet between persons inside the establishment. B, determine the number of persons that may be permitted in any establishment at any one time by permitting one person for every 30 square feet of floor space. And C, within 24 hours of the commencement of these regulations, place distance markers 3 feet apart on the floor space of such establishments, indicating where customers must stand while waiting inside the establishment. Wearing of masks compulsory. Residents of Anguilla are kindly asked to note that where a person is permitted to leave their place of residence in accordance with the regulations, A mask shall be worn at all times when in close proximity or is likely to be in close proximity to a person not living in their household. It is important that masks are worn to cover the nose and mouth. Prohibition on public gatherings. There will be restrictions on public gatherings and social distancing requirements. Persons are asked to remain no less than 3 feet away from any other person, and where lawful gatherings are allowed, the size of the group shall be no more than 5 persons. Prohibition of restaurant sit-down services. No restaurant or approved food establishment shall offer sit-down services during the period of the regulations and shall only offer takeout services in accordance with physical distancing requirements. Closure of licensed premises. All premises licensed under the Liquor Licenses Act, Revised Statutes of Anguilla, Chapter L75, shall be closed for the period of the regulations. This does not apply to grocery stores or wholesale food and drink suppliers that have been licensed to sell liquor by retail or wholesale. Closure of schools, places of worship, and daycare facilities. The following places shall continue to be closed during the period of the regulations. A, schools, public and private. B, places of worship and religious instruction. And C, daycare facilities. Restriction of visitors at residential homes, hospitals, and prison. In order to reduce the risk of spread of the COVID-19, public visitation of the following institutions is prohibited. A, the Princess Alexandra Hospital. B, Her Majesty's Prison. C, the Zenata Haven Residential Center. And D, residential homes or other medical or home care facilities. Restriction on social activities. It has become necessary to restrict social activity in the following areas. Persons are not allowed to host a private party that includes any person not living in their household or attend a private party not held in their household. Additionally, all the following activities are prohibited: a recreational or competitive sporting event, a banquet, ball, or reception, a meeting of a fraternal society, private or social club, or civic association or organization, a funeral exceeding 12 persons, including one officiant and essential mortuary staff, a wedding comprising more than 12 persons, including the bride, the bridegroom, the official witnesses, and the marriage officiant, or any other social event. Exercise and recreation. I am aware of the importance of exercise to physical and mental health. However, until May 6, 2021, persons will not be permitted to exercise outside or engage in any recreational activities other than in their outdoor space immediately surrounding their home. Additionally, where the outdoor space is communal or shared, persons are required to maintain a physical distance of no less than 3 feet between persons. In this regard, outdoor space means the fenced area outside a person's place of residence or the outside area of a person's place of residence that is located within the boundaries of his property. We ask the public to be vigilant in this regard and help us to slow the spread of the virus and get back to a state of normalcy as soon as possible. Vaccination. The COVID-19 vaccination program continues to be the island's best strategy to combat the pandemic. The Ministry of Health encourages all eligible persons in Anguilla to be vaccinated so that there is enough immunity community-wise to prevent outbreaks like this in the future. As a reminder, the final doses of vaccines that are available will expire at the end of July of this year. This means that to be fully immunized with the second dose, persons will have to take their first dose by the middle of May. I encourage all eligible persons to be a part of the program. I thank you. And these are the regulations that will be go into effect this evening at 11:59 p.m. and will be strictly enforced by the Royal Anguilla Police Force. Thank you very much.
We'd now like to move to the Chief Medical Officer for an update.
So as of today, 3 p.m. or just shy thereof, We have confirmed a total of 55 cases associated with this cluster out of 1,276 persons screened. The cases consist of 50 adults and 5 children, and today's screening included an additional 297 persons from the school system. It was a mix of students mainly and teachers, all of whom have tested negative. So in response to the question that was laid yesterday, the school children contacts of the children have not gleaned any positive cases thus far. At the time of writing, no persons have been hospitalized and all persons are under isolation. The question was asked yesterday in terms of where the cases are coming from, and we're careful to admonish, and I will say again, at this point in time, it's more important the history of the exposure more than locale. That notwithstanding, we're seeing the cases scattered all over the island. Most of the cases are in South Hill, from South Hill, with 12 Blowing Point, next with 6, North Hill, and so on, but really scattered throughout. This distribution is going to become even more relevant and pertinent if, God forbid, we get community spread. But for now, right now, it's linked to the exposure, and we'll just say that it's scattered throughout the island. So again, it's the Farrington, a couple of cases there, George Hill, Island Harbor, Little Harbor, Lower South Hill, Sea Feathers, the Quarter, West End, Black Garden, Crocus Bay, East End, North Hill, North Valley, Welches, Calls Bottom, Circuses, and Loch Rum. With regards to the vaccinations, I will say that we still have that pattern with the quick and dirty assessment. We're really seeing still a distinct pattern between the vaccination among the negatives versus the positives, with upwards of 50% of those who have tested negative so far having had at least one dose of the vaccine, at least the first dose, compared to around 14 to 15% of those who have tested positive that have had one dose. So looking at the vaccination program, we have 7,347 persons registered on the portal, of which 6,505 have received a first dose. And of those, 1,760 have also received their second dose. So I'll stop there for now.
Thank you, CMO. So I'm going to move on to a short briefing in relation to education, and then I'll follow up with allowing the press to ask questions in relation to information. As you know, we are navigating through some very difficult times in education, and I want to emphasize from the outset that the governing principle is patience and collaboration. The education system has many variables in its physical format and even more in its electronic format. On the issue of COVID-19, the ministry has had the update from the Ministry of Health and is glad to report that as of the testing that has taken place thus far, no more children other than the 5 identified have tested positive for COVID-19. And this is especially good news because we know that children under the age of 18 cannot vaccinate, and therefore they depend on us to protect them from the virus. Currently in the Ministry of Education, there are 2 approaches to delivering education to students while we are on shutdown. That's using online learning or instructional packages. On Thursday of last week, the ministry announced plans to transition from face-to-face to remote learning using various platforms, Edmodo, Schoology, Google Classrooms, and Google Meet. At the high school level, we're catering for over about 1,100 students. From Thursday to today, our staff have confirmed the engagement of over 700 students and teachers on the Edmodo platform, which is used for 3rd to 6th formers. For 1st to 2nd formers who are using Google Classroom, they've confirmed 184 students have accessed the platform to date. For those students who are without access to e-learning, we know that not everyone will have access to e-learning devices or the internet, and the Department of Education has been working with teachers to create instructional packages which comprise of worksheets, workbooks, printouts for students who do not have access to e-learning. The Ministry of Education and Department of Education, despite the access to 100 laptops given out last year, we are still in dire need of excess laptops. We're currently working on a program to deliver more laptops to the students, but in the meantime, we will have to use the resources available to us using the instructional packages. We, at this point, would like to thank our corporate sponsors who have stepped up to help, GAF, Flow, Digicel, and Anglec, for supporting education at this time, and we continue to call on individuals and businesses who may have access to laptops to please donate if they can. Parents who don't have access to laptops or to internet are encouraged to reach out to the Ministry or the Department of Education so that arrangements can be made to coincide with the protocols and ensure that your children are able to continue engaging with educational content. The transition to online learning was obviously very sudden given the circumstances, and since moving from face-to-face instruction, teachers have had to move to digitizing their lesson plans, something that needs time and assistance with planning for students who have different needs and are of various abilities. So we are practicing some patience in relation to moving to the online platforms for some students. We know that even though we have an online platform for some students, that engagement online can be difficult, and some students do need face-to-face instruction. So we are trying to use our online platforms as best as we can in the circumstances. So continued support and patience is very necessary. We've had a number of teachers and students getting tested today and yesterday. I'm thankful thus far that no one has further tested positive, but we also know that the circumstances are very distressing. So we want to continue to encourage parents to reach out to the department if they're having problems with accessing online. The acting CEO and the PS of Education will give further information as it relates to SBAs and IAs, as we're currently in that cycle at the moment.
Teacher Traceland? Good afternoon, everyone. As we are in this lockdown period, we know that at this point in time in our education, students are at the end part of completing their SBAs and IAs. And so right now, our students are still in that process. Teachers are working closely with the students to complete. Some of them would have already breached deadlines because CXC would have their deadline and our department would, and so the schools will put on to make sure that all SBAs and IAs are completed on time. So right now, our students are still completing SBAs and teachers are working with them. So we are encouraging our parents as much as possible to work with your child, make sure that they continue to complete, because really we should have been almost at the end of that process. And if parents are still in doubt, you can reach out to the school to find out more about how you can help. We know that the practical subjects, that will be a challenge. And right now, the principal and they are looking really and truly how much can we do if we have that total lockdown in terms of the practical subjects. So I guess from here on, we would have to look at what are the next steps in terms of our SBAs and our examinations on a whole.
Thank you, Teacher Traceland. Just to follow on, we will be looking, and we have been communicating with our external bodies to ensure that our students aren't prejudiced during this time in terms of completion of their SBAs and their IAs, especially those that are dependent on the practical subjects, practicals. So that would be BTech subjects, performing arts, and one or two other subjects that would need to do in-person assessments. But nevertheless, these circumstances are overriding, and therefore they are extenuating in that regard. But as it relates to support for teachers and students at this particular time, we have been working to provide some support through our teachers. We have our educational psychologists available. So persons who are experiencing any difficulties, there are resources available, and the Department of Education will be publishing these resources on the Facebook pages for you to access if you are having any troubles.
Minister, I just wanted to add to that in terms of support. We also have the SAFE hotline that is a general hotline, but certainly anyone can access it for additional support. We realize that these are really, really trying times, particularly for parents and for students and for teachers, for that matter. This is a different platform that we're moving to, and I think people will need support in executing. We also had, during our last lockdown, Facebook support pages specifically for teachers and for students. We will be reactivating those, so folks can look out for that as a means of support as well. But I just want to reiterate what the minister said in terms of patience and collaboration, because that's really what's required right now during these times.
Okay, that being said, I think that we can open the floor to any questions from the press. So they can indicate now whether or not they want to ask any questions. We want to keep this press conference as targeted as possible. Okay, we have one question from Hammer. Okay, sure.
Good afternoon to you. Good afternoon to you. The variant, we know that you would have sent off the sample for testing of the variant. Were we able to ascertain what type it is we have here in circulation?
Well, we just sent it yesterday. Just to note that a few minutes ago, we got confirmation from CARFA that the assessment has begun. So they're just, but they haven't run the analysis yet. But they just arrived in Trinidad yesterday, Monday. What day is today? Tuesday, right? Yeah, just Monday it went to Trinidad. So they're already processing it.
Okay.
Them.
Is that it? That's it? Okay, we do have a question from the Facebook Live that's being asked to the Premier in relation to the support offered to the Vincentian residents and the ability to accommodate these families who've been affected by the La Soufrière volcano. And based on the new restrictions, how will that affect that support offered? And what are the options to localize Vincentian residents?
Well, I think what we have decided on was that we would contribute 150,000 EC dollars to St. Vincent through the SEDEMA, the Disaster and Emergency Management Agency, that we would, do deferred salaries for Vincentian nationals here in Anguilla. And in terms, we do have closed ports right now. And so that is something that we will look at on a case-by-case basis involving the Ministry of Health. But certainly we still want persons to register their family members that they would like to visit Anguilla. But up until May 6th, we are looking at that in a very careful manner and a case-by-case basis.
Thank you. Any further questions?
Yes, Dr. Webster, yesterday you would have mentioned that they are supported by the British government for our Operation Iron Dome that is coming forth in this period here. any additional support that she may be seeking from the British in this pandemic? In fact, this is a serious matter. Have you requested further support, financial assistance from the British?
Well, we don't know if this operation will be called Iron Dome. That was the previous, name given to it. But certainly there's border security and border control. We do have SAR-1, which is a search and rescue vessel, will be coming out. Another vessel, the Endeavour, should be available, as well as other boats which will be commissioned by the Royal Anguilla Police Force, Immigration and Customs, for border control. And we do know that, and has been stated, our greatest risk was from illegal entry, and that we certainly would be patrolling to make sure that there are no illegal vessels in our waters. Also monitoring, fishermen and any boats that are out on the water to make sure that they are not going across on the south side of Anguilla during this period. In terms of other support, as the governor did say in the release yesterday, that she has requested and has received word that there will be help for any added financial needs for the enforcement. We are talking about the need for further financial aid if this is prolonged, because, as you know, we do have limited resources. And now with our main industry that has been essentially shuttered for over a year, where there was some opening since November 1st, now we are essentially closed in that regard again, where we most likely would need help. And so these are requests that are being made on a bilateral basis.
Okay, and Doc, perhaps we can explain a bit further about the construction lockdown, because this morning there's some questions from a number of contractors. So some more clarity on that area. Maybe you or the Minister of Infrastructure can broaden that a bit more for us.
Well, the regulations are such that construction sites have to be closed for the initial period until May 6th. We certainly, it's a significant public health emergency. We have a cluster. At this point, we are at 55 individuals who have tested positive. We do know that, some construction workers have been affected. And so we want to make sure that we have the best chance of curbing the spread of this virus. And so that requires that we have to put in place the regulations that insist that people stay at home. And all sectors are affected by this. And so so all construction sites need to be closed down as of today. Until May 6th in the first instance. And certainly, the Ministry of Health, the health team will be keeping track, and there'll be continuous updates as to how we're doing and whether that needs to be extended.
Oh, just one more for you. The hotel sector, the tourism sector, how will they be impacted? We know we have tourists on the island still. How is that being handled?
And well, the regulations do allow the hotels and villas where there are guests to remain open and take care of those guests. As you know, we are closed to incoming persons, and that will remain in effect. And so when these persons, they are not prevented from leaving, and I assume once they have left, or as long as they're guests, the hotels will be able to take care of them. There are no bubbles anymore. Those persons have to stay on the property, and that is what's in place for now through May 6th, and then we'll be reevaluated.
Okay, I'd just like to quickly answer the question. Someone asked where can they donate a laptop, they can donate a laptop to education.mailbox@gov.ai. And that is so that they can follow the proper protocols if they wish to drop off a laptop. We have to find out what will be the proper procedure for you to drop off that laptop. So it wouldn't be directly to anyone at the moment. Another question was asked. The question was, can we get some reassurance that the July opening phase is still likely? I have an inbox full of clients and agents asking that and wish to cancel and make alternative plans.
Yeah, I'd like to give that to the Permanent Secretary for Health.
Thank you very much, Premier. We've always indicated that a July 1st opening was dependent on the epidemiological situation. We can't make assurances right now, but we want to assure you in one measure that we're working hard to do that. It depends on how well the community responds now. It depends on how well we lock this down. It depends on how well we certainly break this transmission and come out at the other end with a reliable chance, a realistic chance that we can open up safely. So to give you a date certain now, we will try our best, but we cannot assure you that right now. It depends on how well we respond to this emergency and how well we can stop the spread of this current outbreak.
We have another question from Felicia Hannes. I think the hand was up. Is it still up?
Yes, good afternoon. Good afternoon. Dr. Anjurin, I know you said those persons who have tested negative should still remain at home. I have been receiving a few calls from members of the public who are concerned that some of these persons are still out and about. How are you able to keep track of those persons for them to remain at home?
I mean, the team is still working with the constables as we were before, but we're really employing persons to cooperate. Another layer of that is that there's a subset of persons that have been officially and formally put under quarantine by the Ministry of Health, and we're doing our utmost best to monitor those in the field. But again, we have to implore the general public, and this is why we have the default position of everybody basically under quarantine at this moment, in the sense that we're trying to restrict movements as much as possible. We know the risk, we acknowledge the risk, we can only implore persons to cooperate, and that applies to the wider public. All of us should be restricting our movements right now. Nobody should be out and about, and that is the only way to arrest this situation and to ensure there's no community spread.
Okay, as it relates to testing for the children, we know for the adults, some persons complain about how painful it can be. What type of testing are we using for the kids? Or is it the nose swab or the clip antigen rapid test?
We're doing a mixture of both. It's the same. We're doing mainly nasopharyngeal specimens because we have very competent staff that can administer this. I mean, children even before COVID used to get nasopharyngeal swabs, right? So we have actually some tiny swabs. We're doing rapid antigen and then confirming with the PCR. And for the very, very small children, we can do oropharyngeal swab, but it's still going to be the same test being done.
Okay, we now have a question from Don Hodge. Hi, Don.
Can you hear me?
Yes.
Okay, sorry, I was muted. So Dawn Hodge from the Daily Herald, question for the Premier. Question concerns the Iron Dome, the restart of the Iron Dome. Assuming that all goes well and we reopen on 6th May, the island, will the Iron Dome continue, or does the Iron Dome again go away when we become more relaxed?
Well, as I said, I don't know if this will be called Operation Iron Dome. Certainly, it is border control and security, and we anticipate that this will continue rigidly. And one of the things is resourcing, and I think that we have called upon Anguillians to be patriotic and to not violate the orders for border closure. We have also asked Anguillians to be vigilant, and if they see any illegal activity to report it. And so we expect that to continue, but the borders will be monitored, by the Royal Angular Police Force, the special constables, to make sure that these violations do not happen. And that will continue even after May 6th.
Thank you.
Do we have another question from Felicia? Or is your hand still up?
Thank you. I just wanted to know quickly, Dr. Andrew, even if persons who are not related to the cluster, if persons wish to get tested, can they do so?
Oh, absolutely. We're encouraging that. As a matter of fact, we have been prioritizing the cluster for obvious reasons, but we're not going to discourage anybody from getting a test at this time. We'll only have to put in some caveats there if the numbers become untenable and it starts interfering with the cluster investigation. But of course, we'll welcome that at this time.
Okay, thank you.
There's a question. What is the estimated infection rate and prediction of disease spreading based on the initial individuals? I guess that's for
well, right now it's around 4% of persons positive, and at one point it's around 15%, but we have to look at those numbers cautiously because we still have small numbers. When you're doing small numbers, they're very erratic and very, what we call, unstable. But we haven't seen an increase in the positivity. The denominator, which is the number of persons screened, is really far outstripping the number of new cases. We're not going to rest on our laurels because every time we have a positive case, it starts the cycle of contact tracing, and there's a potential for an explosion of cases. So right now it's not looking worse, but it's not looking great. And we're concerned about the size of the cluster, the fact that we know that we will probably miss a few cases, and that is why we're saying the best thing for persons to do right now is to stay put, lock down, prevent spread, do your normal hygienic measures, but mostly restrict movements. So that it is. So in terms of the positivity, we're under 5% in, total out of the total number tested, and we're doing a broad-based screening. So that's encouraging, but we're far from out of the woods.
Okay, thank you, CMO. There's another question. Those who have already tested negative, would provisions be made to have them retested at the end of the lockdown period, similar to the procedures required for guests who are visiting?
Actually, that's going to depend on two things, right? The period of lockdown, when we put you under quarantine for 14 days, should take care of the infectiousness. However, what we're going to do the next couple of weeks is look critically at who really fits the criteria of direct contacts. We've thrown the net wide, and we've swept with a very broad brush, especially for the school system, to be quite honest. A lot of these persons were not true contacts, but we prefer to be aggressive in our screening. So that is going to determine how we prioritize the testing out of the quarantine. But again, a 14-day quarantine, if properly done and people cooperate with us, should take care of any traces of infection. So that's why we're imploring the general public, while we look at tightly within the surveillance team, those persons who are really, really, really high risk or direct contacts of those persons, and then evaluate from there and do a spinning out starting with those persons.
There's a question from, thank you, CMO. There's a question from Don Hodge.
Can you hear me? This question is for the health team, and it's a follow-on to anyone wanting to be tested. I think people are starting to get really nervous every time they cough now, or there's a scratch in their throat. So could you just quickly, you said if you want to, you can have it done. Could you quickly just review the process for doing that? For coming
thanks
in.
for that, Dawn. Yeah, actually, I forgot to mention, and my team downstairs will choke me, actually, if you didn't give me this opportunity. Remember, every press release we have said, call in the numbers and we'll sort you out. You have to call the hotlines, and then you'll be guided accordingly. So thanks for that. But you'll see the repeated message in the press releases that you call the hotlines before.
Thank you.
We have another question from Felicia.
Thank you. Good afternoon. Dr. Webster, saying that we're now in this situation and we are using masks and even more sanitizers, will government be implementing duty-free concession on businesses bringing masks and those type of things?
Those will be considered again. Remember, that was in place previously, and we found that the supermarkets were not passing on the savings to the customers. But certainly now that this is, hitting us in the face again, literally, we will take that into consideration.
Okay, thank you.
We have a question from Dawn and then from Hammer. Go Dawn and then Hammer.
I'm sorry, I didn't put my hand down. There's no question from me.
Okay, let's get the question from Hammer.
Okay, yes, I have a question for you from someone here. They're saying CXC currently is allowing islands to defer the exams until January of next year. Will that be allowed here in Anguilla? This is a question I got from one of our callers here a while ago. Will that be allowed here? That is for Minister of Education.
Sorry, can you repeat the question?
I had a note from someone here a while ago who said that CXC is currently allowing islands to defer the exams. CXC, I believe, is referring to until January of next year. All right. The question is, will we be allowed to do that if that's the case? If the case gets worse, is from one of our viewers or listeners.
Yes, that is an option to defer. However, the deadline is coming up quite soon. It may have already passed, Teacher Tracy, and I'm not 100% sure of when the deadline is, but I know that it is soon. That is an option, though.
Okay, thank you.
Deferral is available to all countries as far as I know. But that would have to be something that's elected for. But there's another question that was targeted at the health team, and maybe this could also go to the Minister for Infrastructure. Are private local charters available to fly out? If so, what protocols are in place for airport employees and pilots?
Yeah, there's no prohibition on persons leaving. It's the same protocols we've had all the time. The crew for both the pilots and the boats have been trained. It's the same protocols that we use. They are allowed to leave based on the protocols, and in particular, the scheduled charter boats would have had a blanket approval from the Commissioner of Police early on to allow scheduled. But certainly if somebody wants to leave based on the emergency border control measures, they'll have to get permission from the Commissioner of Police to leave Anguilla waters. But yes, persons can leave. The charter boats have been operating now since last year. They know the processes and the procedures, and you just have to once you get approval to enter St. Martin or to enter the States, the testing and so forth, you can leave.
Okay, we have a question from Hammer.
Okay, hardware stores, how will they be allowed to operate during this period? That's one question. And the other question, will any relief measures be put in place for persons who are not working or will not receive a wage during this lockdown period?
With the closing of the construction industry, hardware stores will also be closed. We want to stop movement as much as possible. We're going to have the groceries remain open, certainly for food and other items that you need for sustenance. But as of now, because of the shutdown of the construction industry, hardwares and those type of activities are also closed for the next few days until May 6th, and will be assessed at a point in time.
And in terms of the second part of your question, Hammer, we still have the underemployment, which through Social Security and also through Ministry of Social Development / Ministry of Finance for the $1,000 EC a month, and that can be assessed. That is in place until May 31st, and we are looking into expanding that if the resources are available.
Thank you. We have another question online which asks, will government put something in place to keep an eye on price gouging at this time?
Well, I can assure you that given the history where we left it up to the honor system and then had a supply officer which checked, and we were able to ascertain that the savings were not passed on, that we definitely will be putting in place, regulations regarding that. I mean, there was, last time where supermarkets were not allowed to, raise their profits above 40%. And, certainly that was not enforced. This time we will make sure that it is enforced.
Thank you, Premier. There's a question to the medical team if they will be continuing their mobile vaccination program by going house to house to administer vaccines to persons who may be afraid to leave their house to do so.
Well, I think the program is going to be two-tiered. For those persons who we go from house to house will be those persons who can't really come out of the house, the elderly, disabled, and so forth, as we've done before. We will not change that. All of the persons who can leave your house, the regulations allow you to leave your house and come for healthcare, including vaccinations. In fact, now, because the vaccinations are done to drive-through, it is so quick and efficient. I mean, before midday this morning, we did over 200 vaccinations. So you can drive on the park, get your vaccination, and get back to your home rather quickly. So we will not yet be going back to houses because certainly we want to get the massive drive done for the masses, but we will be going back to certain areas quite shortly for those persons who cannot leave their homes, who physically cannot leave their homes. But if you can leave your home physically, we encourage you to either drive in your car or get someone to bring you, whether it's a family member or whatever, to the park to get your vaccination done.
Yes, Hammer. Hammer?
Oh, my hand is still up. So sorry about that. My hand should have been down. But when I'm up here, though, Dr. Webster, sir, can we still achieve our July 1st, you believe, based on what's happening now? How do you see those prospects for us achieving, our reopening?
Well, the permanent secretary answered that earlier, but the plan is that if we stay at home now, we follow these strict protocols to stay at home, to isolate, quarantine, not mix, no public gatherings, that we still have that chance that we can get past this cluster and still have a July 1 opening. And we are still encouraging people to get vaccinated, because remember, that is contingent on that we get herd immunity, which is at least 70% of the population vaccinated with two vaccines, and then have up to 21 days after that, so we'd have immunity. So I'm asking and encouraging everyone to get vaccinated, to get immune, improve our health, and to get us back on track.
Okay, we're only taking three more questions, and then we'll be wrapping up. We'll take one from Felicia and then two from the live.
Thank you. Dr. Webster, some businesses are sanitizing their offices. Will this be done for government as well?
Yes, it is recommended that all offices be sanitized, and then we practice good hygiene, hand washing, using soap and water for 20 seconds or more. And if water is not available, using the alcohol-based hand sanitizer, coughing in disposable tissue or in the crook of an elbow, avoiding persons who have flu-like symptoms. And we're asking anybody who has flu-like symptoms, cough, sneezes, runny nose, to stay home. And this is the only way that we can, prevent the spread of this disease.
Okay, so I just wanted to update that the deadline for the SVAs and IAs is the 1st of May. That means that these IAs and SVAs should have already been in their final form at this point. And simply to follow on to what the Premier said in relation to the supplies and the concessions on products going out to persons, concessions being passed on to customers. These were only passed on in some cases. In other cases, they were not. So we want to have an honest system whereby we can believe in persons passing on the concessions to clients and to customers, but our experience has been that not all stores will do it, only some will. And given the effort that it takes in terms of monitoring that effort, the government has to carefully decide whether or not to do it again. There's also one question in relation to construction. The question is, how does it affect heavy equipment operators, particularly trucks transporting loose dirt and backhoes and excavators involved in civil works? I guess this is a halt in construction.
I'll ask the PS to answer that one directly, because I guess people don't understand when I say that, you know, all construction should cease as of today. And then we will reevaluate after May 6th.
Hello, Premier, can you hear me? Hello? Can you? Okay,
I can hear you, yes.
Sorry, I dropped it a bit. I'm sorry. Technology on this side. Yes, certainly. We're doing this by sectors. Certainly, these equipment operators are part of the construction sector, and we expect that the entire sector comply. At the end of the day, we are trying to ensure that we do stop the spread of this virus. This is no joke. This is something that we have been fearing for quite a bit of time, and we know in many instances we did not shut down the construction sector last year, but this year it's become necessary for us to do that. So we want you to bear with us over the next few weeks. It's right now to the 6th of May. Once we get this stuff stabilized, then certainly we can look at it again. But yes, it's sector-wide. We're hoping that everybody in the sector does comply, because once we start giving exceptions, that's a problem. Once we start giving the exceptions, we don't, where will we end, you know? And then who do we give exceptions to? Do we give exceptions to person B, person A? Do we give exceptions to person that have large amount of equipment or small company? What do we do? So to avoid all of that, we simply say no, the entire sector at this point in time is going to be closed until the 6th of May.
Thank you, PS. Just to clarify one more thing, the deferral for CXC is on the 1st of May. The deadline for CXC, not the internal deadline, is the 30th of May. So we still want students to send in their SVAs and their IAs at this time, because this is the final week. So it should have already been close to completion at this time. So at this time, we thank everybody for paying attention to the Governor of Anguilla virtual press conference. We'll have some closing remarks, and then we will see you tomorrow for our next virtual briefing.
Thank you, Minister. Certainly, you navigated through this like a true soldier. You know, and we got the word out on education and how it's affecting our students. Certainly, we don't take these things lightly when decisions are made that affect the education of our children. But health is paramount, and health is our first priority. And we have to make sure that the nation is healthy so that we can continue education, continue the economy, and continue the well-being of our people. I just, you know, want to say that we have 55 positive cases. We've tested, over 1,200 persons, and that does not mean that there are only 55 positive cases in Anguilla. Those are the ones that we have tested and that have come up positive so far. So that's why we're asking people to stay at home, so that in case the way the science works with the virus is, it can spread from person to person. If we can isolate it so it doesn't get a new host, then it, burns itself out. That is why we're not just putting these regulations in place just to harass you. This is important. And the COVID hotlines are 476-7627 or 476-SOAP, SOAP, 584-4263 or 584-HAND, HAND, or you can check the Facebook page or the website, www.beatcovid19.ai. If you have any questions or concerns, call the one of these hotlines and someone will answer your questions, and then can determine if you need to be tested, tell you where to go. Remember, the vaccination program is our best way to get past this. If we're vaccinated, we have a higher chance of not being able to get infected, of not transmitting the disease. We also have the best chance that we can open up this country and that our main industry, which is tourism, can get back on stream. So I'm asking again that, those who are not vaccinated, that they go and get their vaccine at the Anguilla Football Association Stadium. And also for the second doses at the Ronald Webster Park. And certainly I think you can see this is going well. We can beat this. We will beat this, but we can only do it with the help of you, the people. Stay home, stay in place. If you have questions, call the hotlines, the Ministry of Health. I want to thank the Chief Medical Officer, the Permanent Secretary in Health. I want to thank the Permanent Secretary in Education, the Acting Chief Education Officer. I want to thank you, Minister for Education, and all the other ministers who have joined us. Again, the media, thanks for coming out. We hope that we have informed you. Tomorrow again at 3 p.m. we will update you on the situation in health, the vaccines, and also any pertinent information. Again, want to thank everyone. Have a blessed day, and may God bless Anguilla.